Hello, everyone. Starting a Moxie Live question and answer session for those of you who are interested in high-dose estrogen, perimenopause questions, menopause questions. So I hope everybody's able to join that I invited, which I think people have lives and can view this later. But in the meantime, as we're waiting for people to join, I'm going to start answering some questions I have picked up on Facebook. I tell you that the questions that I'm getting from women are incredible. It's amazing how smart you guys are with this. I mean, more educated and researched than most physicians. So these are good questions, and I guess I'll just pick one and start going. Chrissy Lonnie, you have some great questions, and I'm going to scroll down here, and you're the reason why I really wanted to start this. These questions are extensive. They're not simple chat return answers, and as some of you have seen, my answers are quite lengthy. And they're lengthy because you have to understand where I'm coming from with it, or understand a concept before you can understand the answer. But I was asked, I believe it was by Chrissy, about what kind of hormones I'm on, and when I knew to switch from Wiley estrogen to the weekly injection. So so I did change the group to a private group. So everybody, okay, so yes, the group has gone closed and private. I want you guys to feel comfortable, and I hope everybody that joins us today, this link is only going to be available for those in the group. I think I set it up that way. I hope I'll double check. So I changed the group to closed. Apologize for the I don't know. I didn't mean to keep it open. I guess I thought if I left it open that women would want to join, but I see that this is very important for women to feel safe. So I have no problem closing it. So let me pull up Chrissy. I'm still trying to figure out the technology thing. But the question was, when I knew to switch from the Wiley protocol estrogen to a weekly injection. And by the way, the weekly injection, I love. I just increased my dose to 0.03. So I have a dog in the background. I apologize if you can hear her barking. And my office is by the hospital under construction, so it's noisy. Hormone replacement therapy isn't the same for everybody. Not every method works for all women. And some women do well on a low dose patch, and some women do better with higher doses of estrogen. And Wiley, one of the things that Wiley did in her development of the Wiley protocol was change up the dosing methods that mimic a woman's physiology, so that the hormones a woman takes on day 1 is different than the hormones that she takes on day 12. And after day 12, the hormones decline to an all-time low somewhere around day 18. And then the estrogen creeps back up a little bit and peaks around day 21, and then it drops back off day 28, hopefully a woman finishes, is in the luteal phase and will start her period. Day 1 is the first day of a woman's cycle. And with a Wiley protocol, you start off for the first 5 days off of 1 dose. And then on day 6, you titrate up that dose to, usually you increase that dose by a little bit, so that the next 3 days you have a higher dose. And then for the 3 days after that, you have a high dose. So that by day 12, full moon, if women's bodies are cycling correctly, then they will be at their peak. This peak, if the estrogen is high enough, upregulates a trigger that upregulates the body to say, I'm going to need to produce I'm going to be producing progesterone in similar quantities, build receptors for progesterone. So what happens is the brain says produce receptors for progesterone in anticipation for progesterone kicking in around day 14. So when progesterone comes on board in healthier doses on day 14, as it peaks up to day 21, just like the estrogen has its peak, progesterone has its own peak. And when at day 21, there is a peak in the progesterone, this peak in the progesterone, if high enough, will upregulate estrogen receptors in anticipation for a healthy dose of estrogen in a few days at day 12 of a woman's cycle. It's this cycle, this rhythmic dosing, this mimicking a woman's physiology that gives women the one of the ways that makes her feel so good. Her body is functioning the way that it's supposed to. And if all is good, then the practitioner has the dose that eliminates every symptom a woman has. Now, how a doctor determines what dose that is depends on the patient. When I first started the Wiley protocol, I had been without estrogen for quite a while. And the little bit I started out with felt so good. And I couldn't imagine feeling any better because I'd been so estrogen deficient. And so the doctor, after seeing the doctor and looking at my labs, he said, well, you may feel better than you've ever felt, but you're still going to feel even better. And I said, I don't know how I can feel better than I do right now. I've never felt this good, and it makes me nervous because I'm not used to feeling this good this many days in a row without blowing up or not knowing what's going to come out of my mouth. So I said, how long is it supposed to last? And he says, well, this is how you're supposed to feel all the time. And I still didn't believe him. I felt like the other shoe was going to fall at any moment. But pretty soon I got used to feeling good. And he was right. He did increase my dose, and I went up a dose with a Wiley. And though I still had other symptoms or clues that my body was telling the physician what I needed in terms of my hormones, such as when you increase the dose of estrogen, your body's going to respond. These responses are clues that tell us things. So women who are starting out with the Wiley protocol, who have never been estrogen balanced, they go through puberty, really, because their body is actually getting the estrogen it was supposed to get at puberty, but instead women are put on birth control pills and put in chemical menopause most of their life. So women don't have this feeling what it feels like to have real estrogen on board. But the patient may still have aches and pains, and they may still not sleep through the night, or they still may not have a libido or even want to have a libido, but they feel good underneath it all, or they're bloating, or their boobs hurt. This is one of the things that happens in the first few months of the Wiley protocol. Now these clues tell us things. The sore breasts and the bloating tell us that the woman basically does not have enough receptors for the estrogen she's giving herself. So it takes her about 3 cycles of upregulation of the the estrogen receptor and the progesterone receptor upregulation so that the body can absorb the estrogen. I know this is kind of lengthy. Basically, once you get the patient to their sweet spot, meaning that the patient has no more clues that tell us that we need to make adjustments. Basically, the patient is pain-free, is happy, content, can't imagine feeling any better. And the labs coincide. The FSH is where it's supposed to be. The LH is where it's supposed to be. The FSH is suppressed under 5. The LH is suppressed under 2. The estrogen, typically women feel their best when their estrogen is somewhere. Doctors tend to be more conservative because they have this fear that I'll talk about at another time. But personally, I believe women do best. What I've seen in the clinic and what I've observed is that women do best somewhere in their estrogen levels between 300 and 600, never dropping below 200 ever, even on the lowest day of the cycle. When women drop below that, then they get symptoms. They get headaches, they get sore, their muscles atrophy, they get moody. So we know that when women's estrogen gets below a certain level, that she's going to have symptoms. I mean, it's actually really not, it sounds condescending, but it's really not rocket science. It's when estrogen gets low, patients get these symptoms. When estrogen gets in a certain range, patients no longer have those symptoms and they feel alive again, like they're just starting out. So this is the goal, is to get the patient to the place where they cannot imagine feeling any better, and the labs coincide, because the patient will come in over and over saying, oh, I can't imagine feeling any better. So now everything matches up. Now that can go on for a while, but life happens. And just because you have hormones on board doesn't mean that you're good to go and that's your dose and that's the amount that you're going to take forever. What we have found over the past 12 years is hormone replacement therapy is nothing but management, just like diabetes. Some methods work for some women for some time, some longer than others, some not at all. And this is where it's difficult to find a clinician who knows what they're doing, because this kind of medicine is both an art and a science. So if you have a clinician who's willing to treat the patient and not the boundaries, not the reference ranges of the lab work, then, and if that doctor wants to figure out how to really tweak the protocols they're using to get the patient where she needs to be and maintain that, that's what doctors need to know. They need to know what to do at this point, and they're not being taught this. However, I'm doing what I can to change that up. So once a woman is hormonally balanced, like I was hormonally balanced for a while on the Wiley protocol, but then, like I said, life happens. Something can get in the way, and such as a loss of a job, a divorce, a breakup with a friend, or a bad argument, or something that's going to move, anything that would just kind of moves your life off track. So what tends to happen is the hormone levels that worked before, because you're under so much anxiety and under so much stress, all of a sudden cortisol kicks in. And when cortisol kicks in high doses, it tells the estrogen to shut up. It tells the estrogen to back off, that it's going to take over. And it's not until the patient gets out of this state of adrenal fatigue that we can get the hormones back where they need to be. But what we found is this is something you can do at the same time if you have a clinician who understands this concept. Because the patient's going to need the hormones to give them the strength to be able to handle the situation that they're in. However, if they're hormonally balanced, they're not going to go into a similar place they used to go when tragedy would occur. Like they won't they don't typically go into a deep depression just because they have loss of a job, if that's what would happen before hormones. So the goal would be to get the patient back. They'll start to have symptoms of no hormones, even though the last time you saw the patient, they looked good, the labs look good, you know, they had a good clearing. Now we're in the maintenance. We're not in the balancing phase. Now we're in the maintenance phase. So the patient's now bumped back to the balancing phase. This balancing phase now we have to change up something. Are we going to change up the dose? Are we going to add another patch? Are we going to change the method of delivery? So what are we going to do? And so this is where the relationship with the pharmacist is really important. Especially, there's a real a triad that takes place between the pharmacist, the physician, and the patient. So when these things occur, the physician or the pharmacist can help the patient because everybody has the same goal: get the patient back where their sweet spot is. And that sweet spot number changes too. So the sweet spot for me was much lower. You know, now it's a little higher. So at that point, there was a point where some things happened that I was dealing with, and I had to change up. The Wiley wasn't working for me anymore. And so we did all the different adjustments that we could with the Wiley. I mean, we went high dose static Wiley, and that worked for me for a while. And then we were having some absorbability problems. And so women who have problems with the Wiley protocol tend to get absorbability issues. So where the patient puts the hormones on is critical. And is there enough fat? Because these hormones need to be absorbed in subcutaneous fat. And is the skin thin enough? Is the skin able to receive the hormones? And is the patient clearing off the base area? One of the things that happens with women on protocols like the Wiley or the Panacea, using the creams, you can't build on those creams. Between each application, you really have to exfoliate those hormones off. So there's some issues with the Wiley protocol, and one is transference. But the goal is to get the hormones to absorb. If typically we don't recommend topical creams to women with small children because of transference. We really don't want that hormones to be transferred to pets. And another thing I'm going to throw out there that most of you don't know with transdermal hormones, not the patch, but the creams, that would be the transdermal ones. Well, so is the patch, but okay, my dog is really annoying me. I hope you can't hear my dog barking. It's driving me nuts. That's why I can't focus. Hormones tend to get into clothes, and all the good stuff in detergents a few years ago has been taken out. That's why your detergent doesn't work anymore. If you aren't using OxyClean or something like borax or some sort of oxidizing type of phosphate supplement in your wash, your hormones won't rinse out of your clothes. So those of you with small kids taking creams, and even the patches, just if you can get some OxyClean, that's really the only thing I've been able to find to rid the hormones out of the clothes, and double rinse everything to get all that out of there. The single rinse doesn't work well. So anyway, I don't know how to use this Google thing, and I don't know if anybody's with me. So I'm just going to continue until I'm tired, I guess, or until 1. I have an appointment at 1:15. Okay, so Chrissy, what I did is I got to a point where I tried everything I could to absorb the Wiley protocol, and for some reason I couldn't absorb it anymore. I had symptoms of all the different ways I tried using the Wiley worked, and I was able to maintain the doses that worked for me for a while, but then those stopped working and my doctor seems to think it's me. So, well, and he says he sees that in other patients too, but I've tried every way. So the next method that we went to was we went with Dr. Wilson's protocol, Dr. Robert Wilson's protocol, who wrote Feminine Forever. I usually have that book. Okay, hold on. Okay. This Feminine Forever was written by Robert Wilson based off of his work in high-dose estrogen therapies. If you have not read this, it will piss you off, because there was a doctor after World War II that was doing what we're doing, and he figured it out. And so I am doing the dosing that he did on his patients, but it was a different getting my dose that way. But I have to tell you, even on the Wiley, I feel so much. I've never felt this way before, and I just increased my estrogen to a 0.03 dose once a week. So right now that's working. And I got that dose. It's hard for people to find out how to dose. And so trying to figure out a way to teach the doctor how to get to that, because not everybody has the same access to labs as I do. How I got to the right dose for me was based off of Dr. Nagel, my physician, looked up what Dr. Wilson used on his patients and decided, based off of some criteria, what dose to start me out with. And so we decided to, and this is how I've done hormone replacement therapy. This is why I know so much. So I took the dose, because I had been dying to do his method. So I took the dose, and then the next day I took my labs. I got my blood drawn, and then the day after that I got my blood drawn to check my estrogen. So I checked my estrogen the day after that, then 2 days after that. And so pretty much we did this a few times. So I checked my estrogen nearly every day of the week. So I saw where I had a drop off, which was somewhere around between day 3 and 4, where almost half the dose was gone. So dry in here. And then I can feel a bit dragging in it towards the end of the week. So the first dose was really high. And so basically after a few weeks and a few doses, I was able to dial in on what keeps me in a certain range. Now, one of my issues with switching over to these weekly injections is the lack of ability to cycle it like we could the Wiley. Because really the best way we can treat our body with any kind of medicine is to simulate the natural body as much as possible in its healthy state. That's the goal. And so we have found clinically that women really do better when their hormones are actually cycled, when they cycle the hormones, that dosing to the Wiley. The reason, well, I can't get into Wiley too much, but there are a handful of reasons why Wiley's not the go, or really it's one of the go-to methods of delivery, but it's not the only one to get patients in their sweet spot all the time. The Panacea protocol is basically a lifestyle program that revolves around the diet, lifestyle, sleep, a stress level, and basically hormones too. And Panacea HRT is really taking all the methods, all the relatively safe, healthy hormone methods, and use whatever works on the patient. So the doctor determines what's the goal of the patient. Does this patient, we tell them the importance of having a period. Some women can't have a period, and that changes things up because they don't have a uterus. So that changes how we dose the hormones. So there's a handful of criteria to determine where to start a patient. And that's kind of what the Panacea HRT is. Well, the patient's going to do well with this estrogen, this progesterone, this testosterone to get the patient where they need to be. So the physician starts them off on the dose that he believes based off of how long the patient's been estrogen deficient, their body size type, and where they are in their hormones. And he starts the patient off on that dose, and then begins puberty. And women don't realize with high dose estrogen, basically you're putting the body in a state of puberty. So anybody that does high dose estrogen or cyclic dosing, rhythmic dosing, high dose estrogen, you're going to go through puberty. And it takes about a year, just like any other pubescent female, for the body to become acclimated 100% to the hormones in the body and the brain. So that's why patients get sore boobs and they get bloaty because they don't have enough receptors. And the next month they have more receptors. So the next month they're not as bloaty. The third month they have more receptors and they're really not as bloaty. And all those things go away. And then those negative clues tend to diminish. And the positive clues are, you start hearing things out of women like, oh my gosh, if I had these hormones when I was married, or it's actually getting your hormone. What I'm finding is getting your hormones balanced and optimized is really only the beginning of this. It is so mind blowing what the mind opens up to. I'm flabbergasted. I'm flabbergasted and pissed. I'm not happy because, had I had hormones years ago, my life would be very, very different, and my relationships would have been different. People would be alive. It is one of the main reasons why I'm doing what I'm doing. I've started a research foundation that my goal is to take this information, these symptoms, these clues that these women give through our tracking device, and that goes into our patient database that we're able to say, okay, well, we have a data pool of 5,000 women on estrogen, and they've been on it for this long, and these are the incidences of breast cancer, and these are the incidences of any disease you can think of, because estrogen in women and testosterone in men affects every single cell and function in the human body. And without it, there is no function in the human body that can function in its healthiest state. So the hormones have to be healthy in order for the rest of the body to get healthy. So it's like thyroid. It's like these doctors are trying to mess around with the thyroid. They're not looking at the estrogen. You can't just look at the one. If estrogen isn't right, your thyroid will never be right. Estrogen always has to be right before anything else will balance out. Nothing else will work. So I switched up to the Wiley protocol from that. Now that's been my case. I know I go off on tangents. I apologize. I hope I don't lose everybody, but maybe you can rewind. Or maybe I can rewind. Let me see if I can get back to Chrissy. I really like all your guys' comments. Let me see if I know how to do this. See if I can click on her and see if I can pull up her comments. I apologize for, oh, she's not a friend, she's in the group. Mm-hmm. Okay, so, I would love to do a live chat, Chrissy, if you're interested. And anybody who's interested, let's schedule a live chat so other women can learn. And I'm happy to work things out with a time schedule. Oh, okay. I'm going to jump over to Emma Nichols. I just started the Wiley protocol. How long was it before you had a period again? I feel like I had PMS, a little bloated, tired, little cramps, but nothing. Okay, Emma Nichols. Just like what I was saying before, you're going through puberty. You may not remember this, but before menarche, before you actually bled, that first drop of blood, your body was responding. You got moody and tearful and low back pain and headaches and possibly migraines, and you felt the lower back area and you felt bloated, but you hadn't bled yet. And that's what's happening, is your body is preparing. You will feel your uterus. It'll feel like you will have some cramping, your little cramps. So your uterus is what's happening, is your uterus is saying, whoa, I'm back in the game. I'm not supposed to deteriorate and die off. I do have a function and a purpose for being. So what happens is that cervix and the uterus starts reshaping and preparing to house an infant, embryo, whether you get pregnant or not, but that's the mindset. So the brain thinks, the hormones are telling the brain that you're in a state of reproduction. So the body's trying to respond to what the brain thinks it's trying to do. So as you go, those cramps, the bloating will go away as you build receptors. So each month you're on this, you're going to have less and less negative clues. So your PMS is going to go away. The bloating is going to go away. So you hopefully, as you're titrating up on your dose on the Wiley protocol, you'll start a period. Now, when you start your period, that will be your new day one. That gets confusing for people. And if you need some help with that, let me know. So if you're on the Wiley protocol and you start your period, that will be your new day one. So I hope that answered your question. You're going through puberty. That's why I tell patients when they start, when they start these hormones, you can't just give it a couple months. I mean, especially the Wiley protocol, you can't just give it a month. And some patients say, oh my gosh, if this is how it's going to be, count me out. And then they stop. And it's like, oh, great. I counsel patients and say, if you can't commit to a year and give this a year, then it's not going to work, because it's a process over a period of time, because we can't just shove you full of hormones. Your body will respond and nobody will be around you, not even yourself. And so the goal is to get your body acclimated and cycling the way that it's supposed to, and you'll go through the various stages of optimal hormone balancing and get to the point where you'll be like, you mean I didn't have to take all those medications? I wasn't really bipolar. I wasn't really depressed. The whole bipolar thing just really gets me, because every woman is bipolar, because on day 12, her estrogen is at the highest it's supposed to be. So she's going to feel good for at least a couple days, and she's going to crash and feel like crap on day 18 when her estrogen crashes, somewhere between day 18 and day 20. She's going to feel good for maybe a day before her period. Not great, but good. Not as horrible as she was feeling right before her period starts. And then her period will start. And each day she's on her period, she'll feel better and better and better. And the closer she gets to her day 12, when her estrogen is supposed to be creeping up, she'll feel her best. Now, women who have periods long after 6 days, that means that your estrogen isn't getting high enough to tell your brain to stop the blood flow. I don't know where to look on the screen. So women say, oh, my period lasts for 10 days. Well, the estrogen is supposed to be high enough by day 6 of a woman's period to tell the brain that there's no baby. So shut it off and let go. And what happens is that when the estrogen doesn't get high enough, that message doesn't get sent. Hormone levels tell the brain what to do. So if the estrogen level's at a certain height, well, okay, well then I'm not pregnant, and it moves on. So if estrogen's low, then that tells the brain of the woman that she has no purpose and her role is over and she needs to deteriorate and decay and die off. The higher estrogen levels tell the brain of a woman that she's young and in a state of reproduction and ripe, and so the body tries to mimic that of somebody in a state of reproduction, not only internally, but also physically. So the body changes shape. I used to be 35 pounds heavier before the hormones. So my friend Sandra Samaya Cruiser, I call her Sandra because she told me to. I guess it's her. She's a patient, and I am training her to be one of a menopause coach. And if any of you are interested who are doing high dose estrogen and kind of get what I'm saying or want to learn more, I need more coaches. So I have a handful of friends, close friends right now that I thought I lost to perimenopause, who are taking the hormones now, who've been kind of bashful with, but Samaya is not. So she's helping me. That's why she keeps defending me. Let me see where another question I can answer. If the weight I gained during, another one from Emma, if the weight I gained during menopause, can I lose this on Wiley? I've tried everything, eat clean, work out, etc. As soon as I hit menopause, my body wouldn't burn any fat. This is a really good question. It's a good question because I actually have an answer that's real and that you can put to the test. And this is what happened to me. So keeping in mind, we want to mimic the body as close to natural as possible. Healthy, natural, not unhealthy, natural. So we look back at what did the hormonally healthy 25-year-old something look like in Paleolithic times? Well, she wasn't fat. She had enough estrogen. She was beautiful, and she had energy, and she wasn't bitchy. And she started her period somewhere around 18 or 19. And it was at that time that women had children. The younger you had them, the better. The signal of having a period was now it was time to have children. And then after the birth of the first baby, the body after that first baby tends to bounce back hormonally back to kind of that healthy reproductive female. After the second child, because her ability, we're supposed to have as many kids as we can feed at one time. So the body is designed to have 2 kids. It prepares for 2 kids. If a woman has her children in her mid-30s, when her hormones begin to decline, if she hasn't had kids, then when she has children in her mid-30s, she really has a tough time with postpartum depression. Women who have a tough time with postpartum depression, typically were low going in from the get-go with estrogen, and it was lucky they got pregnant. Because typically the estrogen kicks back in after the woman gives birth around 3 to 4 months. This is a period of time where the body, the brain of the birthing mother determines whether this infant is going to survive life. So typically all estrogen halts production the moment a woman pops out a baby. And so usually within the 3 to 4 month time period of time, the brain of that mother knows that that baby is going to survive life. The estrogen kicks back in, and now she allows to be touched and communicates with the father. The lack of estrogen after childbirth is what puts off the signal to the father to stay off. That's women don't have a libido, they send out a repellent, they're not open for business, they're trying to make sure that their delivery is going to survive. If it does survive, then they have some things that they need to do and continue. They'll produce estrogen, but continue to produce low doses for a while Some women, especially in their mid-30s, will really suffer from postpartum depression because this estrogen will not kick back in, not even close to the way it was before she had kids. So that's women in their mid-30s who have kids usually have a tough time hormonally. And it's hard to socially suppress how really shitty you feel. It's tough having kids in your mid-30s and beyond. And this whole Angelina Jolie thing and thinking that she's, I understand her motives for wanting to remove her ovaries. And there's been talk of her, people mentioning, well, she's going to go into menopause. Right now, this is a real critical time to bring up hormone replacement therapy because it's not being addressed. And when she starts talking about hormones, because honestly, she already has physical symptoms of being estrogen deficient. I can't imagine her any more estrogen deficient. I really wouldn't want to be around her. She has no physical symptoms of estrogen, of adequate levels of estrogen. Estrogen softens a woman's features. It molds her face and her body. It makes her glow. It provides the estrogen. High doses of estrogen provide this subcutaneous layer of this glowing fat that women, when you say fat, they freak out, but this is this glow, and so there's less lines and they're more full. And when you see two older women, they can be of the same age, and one is rail thin, it has no muscle tone, no fat, just bony, and the other one is plump and round. We're drawn to that plump and round one, not because we can hide in her boobs, but because that's the signals that we get from that are of safety and approachability and kindness and not harsh viper-like attacks. Typically, women that's severely estrogen deficient, they're not approachable, and we have subconsciously learned to tiptoe around those women and not spark up anything for fear of the wrath of, we never know what's going to come out of their mouth. And I think we've all been there on having a hard time controlling what comes out of our mouth, especially right before our periods. But that doesn't happen anymore when you have enough estrogen. That goes away. And that is not because you're a bad person. That's not a personality trait. What's amazing is when your hormones are balanced, all this other personality BS kind of sheds off, and this social anxiety and worry about things that really don't matter tend to shed. And now you kind of look at your world like you underneath it all, but yet you haven't been living your life like that because you've either been medicated or put yourself in a predicament, or the labels that we take on, we live those roles in lives, and being numb on antidepressants. We don't deal with things when we're on antidepressants. We're left numb and unable to make emotional connections with people. And then those drugs further suppress our estrogen. So now we really can't make emotional connections, not even with ourselves. So that's what's not one of the things that's nice about the higher doses of estrogen is you kind of like view the world very differently now. You worry a lot less about what people think about you. I mean, you don't disregard people's feelings, not in that capacity, but there's things that used to really matter because you were trying to either soothe an emotional wound or trying to fill an emotional void. It just doesn't, that need to fill that is no longer there. It doesn't exist. It's almost like, well, saying these things, it sounds, kind of crazy, and every therapist will yell at me, and every physician and scientist. But honestly, this was the last thing for emotional healing for anything in the past. All the pains in the past, everything I'm able to put in perspective, and women are able to put in perspective. And I was hoping my girlfriend Mary Kay would come on because she's kind of experiencing this too. So it's kind of like this whole new world that you see through the eyes of who you really are on the inside without worry. But I do warn women on hormones that it does change the dynamic of the relationship. I text my girlfriend. I'll actually text you. Sandra says she couldn't hang out today. That's a bummer. Okay, so this is what I text my girlfriend, Mary Kay. I hope I don't reveal any. This was this morning at 10:41. I feel so healthy. I feel so emotionally healthy and strong. I like this dose of estrogen. I've never felt healthy before. It's strange to live in an emotionally healthy place. I feel like I'm just trying to get acclimated with society and how I fit in it. It seems as though I just got dropped off this planet and in a society and have to figure out how to fit in it with my new brain. Because I view the world so differently and respond differently, every encounter is a new experience, so to speak. Because of the way I view things and respond to things, I'm able to view the world differently. Instead of responding negatively and defensively in a situation, I'm more rational and wordy, rational and judicial with my words when I speak. I don't take things personally anymore. Getting hormones restored is really only just the beginning. It has allowed me to be more open for personal growth, direction, and peace. I find I'm having a difficult time around men. I never used to have a problem before, but I see I behaved in ways to nurture my emotional immaturity and void. It's the concept of, I will dance for you if you pay enough attention to me. I don't have any. I don't need to dance for anybody anymore. I don't have any emotional needs for anybody to fill anymore. What do I do now? How do I behave? I am no longer attracted to the emotionally immature and unhealthy man. However, I don't have any experience with relationships with emotionally healthy men. This is a whole new world. It's exciting and scary at the same time, but more exciting than anything. I went on with another text message a little while later. She knows my significant other who I'm kind of severing the personal ties with. At the risk of sounding ungrateful, I feel so much healthier without blank. I feel like a huge weight has been lifted off my shoulders since I've been able to emotionally detach from him. I feel stronger than I ever have in my life. Being around him now makes me uncomfortable. I would never be with a guy like him. It's not that he's a bad guy, he's a great guy, but I would not choose. We're so much better as friends. I mean, we're redefining our relationship. He's a great guy, don't get me wrong. The less I see of him, the more I realize how dysfunctional our relationship was. Now it's pretty hard to tolerate his bullshit on this level of hormones. So I am finding it that my relationships are different. I now question why I do or have done what I've done and what the purpose of that was and what was the gain, what was the benefit. And so the benefit has changed. And now that I don't feel emotionally so weak and devastated and incapable, and I'm certainly not that. I've never felt that inside. I always felt like I was in there somewhere, and I've gone through bits and pieces of being like this. And this is stronger I feel, the more I could move forward with this movement of helping women find doctors who can prescribe hormones that can give them not only their life back, but actually give them the life that they were intended before somebody stuck them on birth control pills and antidepressants in puberty. I get upset because I feel like that I was robbed. I feel like had we known what Dr. Wilson was doing, had we not dismissed him in the 60s, about the same time the DSM manual was coming out, from the doctors that came back from Puerto Rico, it's kind of like when all this took place. Basically, what we have found over the past 12 years, that 90% of the conditions in the DSM manual just do not exist. They just flat out do not exist. And that was one of the driving forces for my research foundation, so I can show this. Because people are being put on antidepressants and birth control pills every time they go to the doctor and complain, and that's the first step. And so women have never had healthy doses of estrogen. And you know, what I say on my site, I just noticed somebody else who has a menopause site, I referenced a comment. Most menopause sites talk about low static dose hormones. And women do well on those hormones, but only for a short period of time. They eventually stop working because of the receptors. It's like taking pain meds after surgery. You know, they give you a Vicodin, and you take your Vicodin after your surgery, and then the next day you have to take 2 because the first one stopped working as well. And then, you know, and then you have to keep titrating up on your dose, and then you're like, have an addiction. So that's kind of what happens. So the goal is, it's about the receptor response. So when you mimic the body's own physiology, this happens in its own rhythm and time. Now, my concern that I didn't address, that I started to talk about half an hour ago, was my concern with doing the weekly injections was my inability to mimic my own body's physiology. So what I did notice was my body still cycled. So I do the Wiley progesterone and testosterone. Well, I cycle the Wiley progesterone. I static dose the Wiley testosterone, or take it as I feel take the dose that I feel that I need at that day, and or at that time, and then do the weekly estrogen injection. Doing that recipe has allowed my body to still cycle. I still feel, though I don't have a uterus, I can still feel my body cycle. I can feel my boobs change, because boobs cycle through your cycle. You'll notice a difference in firmness and tenderness with your boobs through the month. All these things are trackable, and I highly recommend you track everything. Right now, the best, most extensive app on the market is iPeriod, and my telemedicine HRT platform will have a device similar to that to extract data that we can put into the research and be able to pull out better protocols, and so that we can figure out how we can mimic this without transferring hormones on children and animals, and how we can get it to that we don't have to change the hormones all the time. So there's still this Panacea HRT is by far the most advanced form of HRT on the market. There is none more advanced, better to get you to where your sweet spot is. But it's not 100%. It's about 80%. And it has built off of all the other platforms, all the generations of hormones. Low static dose, the Wiley protocol, all the flaws of the Wiley protocol that we have seen clinically, we had to change that up. And, you know, it's just, so if we change the dose on estrogen, we can no longer call it the Wiley protocol. So anyway, I know this is a lot of information. I hope I'm answering some of your questions. Either people have not figured out how to log on, or I don't know, I don't have any viewers or anything. Maybe I didn't do it right, or maybe nobody's interested. So there's a question here, another Wiley question. How long were you on the Wiley when you noticed benefits? This is from Colleen Croak. I'm on month 7, and I did answer you on this one, Colleen, personally, because it was so lengthy. But I'm going to give a synopsis. She's at month 7 and still hadn't had a period. That's a problem. That typically will probably cause more estrogen dominance. I'll do a show on estrogen dominance, but estrogen dominance is really an estrogen deficiency issue. But if you're not upregulating receptors and you're giving your body hormones and there are no receptors to receive the hormones, use the hormones and then detoxify the hormones out of the body, then the hormones are going to look, the estrogen is going to look for a place to hang out because nobody's there to receive them. So now they're in like Hotel California. So they're stuck. If they have no place to be stored, if there isn't enough fat to store the amount of estrogen the woman has, then guess what? The estrogen creates more fat. And that's why women will it's a different kind of fat. I was estrogen dominant a few weeks ago because I forgot I had given myself a weekly dose. So I gave myself a double dose one week. And I was like, oh yeah, I forgot what it's like to be estrogen dominant. And my body for 7 to 10 days went through this estrogen dominance where I got bloaty and my boobs swelled. I got fat. I can feel it, but it was different. It was just different the way my clothes fit. It was a temporary type of fat. Well, I know it's temporary because I know how to get rid of it. So my body went through that process. I had my headaches and the rest of the body changes that go with the estrogen dominance. And then once my body cycled out of that, then I was good to go. So I lost my weight. So for a couple of weeks, I was 8 to 10 pounds heavier. And that's just how it works. Estrogen decides how heavy you're going to be. If you do not feel benefits on the Wiley protocol within 45 minutes to an hour, you probably don't have a high enough dose to start out with. You should be able to feel it. Most people don't realize that's what they feel. Most people think that that's just one of their good days of the month. Most women have 1 to 2 good days a month. And then they have 2 really, really bad days a month. And then their life exists in between. It's like after those 2 bad days, women are trying to make up for all the bullshit. And as their estrogen increases and they feel really good on day 12, they make amends and they're loving, and then their estrogen decreases again. And their estrogen gets too low, and now they're in their bipolar, their manic phase. And so it's just, that's where this whole bipolar thing comes from. Women on the Panacea protocol there is no existence of bipolar on the Panacea protocol. That goes away. There's a 100% cure rate for that if this is truly estrogen deficiency induced bipolar. And most is, 90% is. So it's hard to find a clinician, even if you go to a Wiley clinician, that they know what they're doing. So before I sign off, I have been looking everywhere for physicians for you guys to go to who can help you optimize your estrogen, who knows what they're doing. And so there's certain language that I look for on their websites that give me an indication over how they think. Doctors who prescribe or who test hormones with saliva are not the doctors you are looking for. You can just bypass those. Doctors who use blood to test for estrogen levels tells me that they dose high enough so that the estrogen shows up in the blood serum. And that's the beginning of the difference. That's where we get into the 4th generation hormones. However, some doctors at this point still don't know how to manipulate this to get patients to their sweet spot. So my goal is to find you guys doctors to help you where you need to be. But because doctors don't really know how to do this, and there is no formal training protocol out there. Right now, the only thing they're teaching doctors is the lowest dose possible for the shortest amount of time. Nobody knows what that dose is, and nobody knows how long that is. What ends up happening is women start feeling crappy again. It stops working, so they stop taking the low static dose. And then they say, oh, I've tried hormones, it doesn't work. And then patients, the ones that refuse to think that it's that they know that it is the hormones, and they need to find a doctor who also knows that it's the hormones. These women typically seek out the Wiley doctors. However, Wiley education is limited to two days in a classroom. That is a theory. There is no clinical training. There really is just a kind of like a 2-day conceptual training. And luckily, I happen to be with a physician who thinks outside of the box, who's been a patient before and knows what it's feel like to feel like crap. And so it's these doctors that really focus in on the hormone levels and getting their patients' hormones right, even though everybody's yelling, oh, but what about cancer and what about tumors? And well, I haven't seen a study ever that says that estrogen causes cancer. However, I've seen many that I will download and put in the files that show how without estrogen, women are more susceptible to cancer. The thing with cancer, and Angelina Jolie I want to get back to, is estrogen doesn't cause cancer. However, if you have any sort of tumor, no matter what kind of tumor it is, whether it's in the eye, the brain, the uterus, the cervix, wherever it is, if you take estrogen and you have an undetected tumor somewhere, that estrogen will increase the rate of that tumor, whatever it is. And you will find out sooner than later, more sooner, that you have this problem. Depending on where you are, depending on where that tumor is in its growth, if the tumor is small enough, the estrogen that you give yourself will fight off that tumor, and you'll get rid of it with the cancer. The cancer will fight it off. However, if the maturity of that cancer is beyond this estrogen repair, then the estrogen will speed up the rate of that cancer, and then you can deal with that as it comes, and your body will be healthier. And of course, what will happen is you'll go to your clinician, and your clinician will say, oh, the estrogen caused this. And you'll roll your eyes because you really know in your heart that that's not the case, because estrogen does not, you don't just get a tumor in a month. So I guess it's been an hour since I've been on, and I apologize if nobody was able to link on. I hope that you are all able to download this later. I'll put a link and hopefully it'll pull up. My goal is to keep these particular hangouts within the group, and I think I have everything set up for privacy. If I don't, please let me know, because I want to fix it. I don't. My intention is not to violate your trust. So if you have questions for me, it actually would, if you can in my email, if you can stick them in the mail them to me, because I get very overwhelmed on these streams. I want to answer everybody's questions, and then things are coming in and I lose who I'm talking to, and I've got these people I'm trying to get back to personally. But what I have found is I have been kind of juggling all you guys. I need to get you guys information to take to your doctors, and I'm looking at it, approaching naturopaths who are interested in being educated. They already have a lot of the foundation of what we need doctors to know in terms of diet and lifestyle to get a patient hormonally balanced. And really, so the next thing they need to learn is how to optimize their patients' hormones and get them to their sweet spot, and how to maintain them there, and then how to switch it up and how to know when to switch them up. So if you know of any naturopathic physicians who are open to any online learning, Dr. Nagel has so generously offered to be available 24/7 for clinicians with patients in their exam room. I mean, he said he would offer his cell phone number, and clearly we'd have to establish a relationship of some sort. But the goal here is so that everybody wins, because the clinicians really do want to know how to do it. And by somebody who knows what they're doing and has a history of why something didn't work or what our experience was on any of the hormones. So I'm going to wrap things up. This is my first Google Hangout, live Hangout, which I told my girlfriends I'm coming out from behind the curtain. I don't live in a generation of taking pictures or videos, but it is the generation. And this kind of medicine is really knows. It's going to be spearheaded by the baby boomer women, as they've done everything else. And when they realize they didn't have to feel like crap this whole time, they will become livid and cause an estrogen movement. Women have the right to feel good. They have a right to life. And then hopefully close far behind that is men, because everything that happens to women happens to men, and men too are falling apart and deteriorating. And now there's a big scare that testosterone causes prostate cancer. I mean, if that was the case, every 20-something-year-old kid would be walking around with prostate cancer, and that would be, that just doesn't make sense. It doesn't make sense. Anyway, the Generation X is what I call the sandwich generation, and those are the women who have baby boomer women and millennial daughters who were born unhealthy and just not even nowhere near where, mind you, I grew up in the 70s. At puberty, well, I didn't, but most young women produce adequate levels of estrogen to get her to the state of reproduction so she can do what she's been here to do, and then die off appropriately after her second child. But oh, there I go. Lost my train of thought again because I thought of something else. Oh, so what? Our Generation X was born unhealthy, basically. So our millennials are starting into puberty without anything. They have these environmental toxins that are clogging up their liver, and I'll do one on that about detoxing. One of the elements in the Panacea protocol is addressing the toxins that are in our body and how we get them, and how we will never be hormonally balanced as long as our gut and our liver is toxic. So if you have gut liver detox issues, please bring those up. No questions off limits. And so if you've watched this whole time, thank you so much. Please email me, let me know. This is supposed to be very personal. I am not a know-it-all, and if I don't know it, I'll ask my colleagues, my advisory board, and I'll let you know where I got my information. Go make it a good day. Thanks for joining.